Good morning and welcome to my YouTube channel. This is Mr. Divo. I want us to look at tonsillitis this morning. So we are going to answer a question concerning tonsillitis or tonsillectomy. So if you have not subscribed, subscribe for more videos and more insight. So let's get started and let's look at this question. So Philip was brought to a ward with a diagnosis of recurrent tonsillitis. He was taken to theatre and tonsillectomy has been done. Now, part A1, they are saying list 2 common organisms which usually causes tonsillitis. Part A2, they are saying list 4 indications for tonsillectomy. And part B, they are saying describe 6 signs and symptoms that Philip will present with. And C, they are saying the post-op nursing management within 72 hours. And part D, they are saying state 5 complications and state how they can be prevented. Okay, very interesting question. So let's get started. Let's look at question A1. Just listing 2 common organisms which are responsible for causing tonsillitis. So just 2, you can pick any 2 from the following you are going to list. Number 1, the first one is beta hemolytic streptococcus, and number 2, it can be Haemophilus influenza. Then number 3, it can be Streptococcus viridans, as well as it can be Staphylococcus aureus. Then, in case you don't like each, you can also go for a 5th one, which is a Klebsiella rofla bacillus. So from these 5, you can pick just any 2 and you are good to get your 4% on A1. Then A2, list 4 indications for tonsillectomy. What are the indications for tonsillectomy? Number 1, we have recurrent or persistent tonsillitis. So if tonsillitis is reoccurring or they are persistent, you can easily go for tonsillectomy, or you can advise the patient to go for tonsillectomy. Then the other one is the hypertrophy of the tonsils as well as the tonsillar malignans. Apart from that, we can also go for peritonsillar abscess queens. It's the other indication for tonsillectomy, as well as the persistent hyperemia of anterior pilus. So these are the indications which you can choose from. The question is asking just for 4, so you can pick any of these, just list them down, then you are good to get your 8%. And then part B, describe 6 signs and symptoms that Philip will present with. So what are the signs and symptoms? Number 1, of course, there will be pain on the throat, which is due to enlargement and inflammatory process. Then number 2, the patient or Philip will present with a complaint of sudden awakening in the night with breathless due to obstruction of the air passage by enlarged tonsils. Then number 3, the affected tonsils has yellow spots due to the presence of exudates. So just after looking at them, we are going to see that the affected tonsils will have yellow spots due to the presence of exudates. Then number 4, there is also continuous pain on the throat and a feeling of rawness. Okay, so this pain will continue on the throat. And apart from that, number 5, we are saying fever of about 39.5 degrees Celsius, which will be accompanied with rigors as well as joint pains. Then number 6, we are saying the patient's mother will complain of sudden onset of heavy snoring of a patient, which is due to narrowing of the air passage by the enlarged tonsils. Then from part B, we are going to move to part C. Part C, they're asking for post-op nursing management. You are going to give within 72 hours. So what is the post-op care you are going to give to Mr. Philip? So on our post-op management of Mr. Philip, you are going to start with your objectives. So what are your objectives? Some of the objectives you can list is to ensure that there is a proper breathing patterns, there is a need to promote airway or to promote healing, there is need to prevent complication, and there is also a need to give psychological support. Then from aims, you are going to move to correction of the patient from theatre. It's a second heading you are going to consider. Now, on correction of the patient from theatre, here you need to state few points which are very cardinal for the examiner. Okay, now, here on correction of patient from theatre, you need to mention to say, I will go with a post-op tray containing the sterile oropharyngeal airway to maintain the patent airway, and also to say, I will use sterile swabs or gauze to wipe away secretions. And also on the post-op tray, there should be tiny depressors, okay, to prevent the tongue from falling back, therefore preventing occlusion of the airway. Now, here you need to also mention that upon arrival in theatre, you need to assess if the patient has recovered from theatre drugs, and also assess for spontaneous respiration by the using of the outer palm, and also to assess the site of incision for fresh bleeding in case of slippery ligature. Then from there, you need to make sure that you get your handover. So here you are going to say, I will get a detailed handover from the theatre nurse on blood loss, fluid repressed, as well as on anesthesia and surgery and analgesics and other drugs given. So after the handover is obtained, you make sure that you make sure that the post-op orders are clearly laid out for you for continuity of care. Then from there, you are going to say, I will transfer the patient to the ward standing at the head side of the patient for easy observation. Okay, that's about transferring the patient. So on transferring the patient, again, we are going to say, I will transfer the patient to the ward on the patient's trolley in recumbent position with the head on sides to promote fluid drainage from the mouth. And also on transferring of patient, you are going to say, I will stand on the head side of the patient for easy monitoring or observation. After transferring, you are going to consider what is known as immediate post-op care. Now, under immediate post-op care, we are going to begin with the environment. So here you are going to describe the environment where you are going to nurse the patient from. For example, you are going to say, I will nurse the patient or Philip near the sister's bay, equipped with emergency drugs and resuscitative drugs and devices such as oxygen machine for oxygen therapy and suction machine for suctioning, therefore preventing occlusion of the airway. Then you are going to say, I will also make sure that the room is warm enough to prevent hypothermia, since post-theatre patients are prone to hypothermia due to blood loss and exposure to coldness in theatre. Then on the same environment, you are going to say, I will make sure that the room is quiet to promote rest, and I will also make sure that the room is clean to prevent infection. Then from environment, you are going to move to maintenance of airway. So here you are going to say, I will make sure that the airway is patent by positioning the patient in the recumbent position with a head on sides to promote drainage and prevent back falling of the tongue while the patient is under the effects of anesthesia. Again, on airway, you are going to say, I will make sure that the head is hyperextended to facilitate free entry and escape of air. Then in case there is need, you are also going to say, I will use the sterile oropharyngeal airway, which will be inserted to prevent the tongue or epiglottis from falling back. Then in case of any excess secretion, you are going to say, I will suction excess oral secretions to keep the airway opened or patent. Then you are going to move to maintenance of breathing patterns. Here we are going to say I will observe the adequacy of breathing by observing the respiratory rate, observing for the presence of cyanosis and the use of pulse oximetry to check for oxygen circulation. You are also going to say I will check for the general signs of respiratory distress such as sweating, use of axillary muscles, of respiration and abdominal breathing to determine if there will be need for or if there will be need to administer prescribed amount of oxygen. Then it's very important that you also monitor the oxygen levels. Then you move to maintenance of circulation. Here you are going to say I will check for any signs of hypovolemic shock for necessary intervention. For example, zero or low BP as well as high pulse, simply to prevent hypovolemic shock. Then you are also going to say I will quickly assess for the patterns of the IV line for continuation of fluid and blood administration in case of fluid loss or blood loss. I will also continue to administer intravenous fluid for replacing the lost fluids and restore electrolytes in balance and to maintain the normal blood volume. Here we are also going to mention the fluid balance chart. Therefore, we are going to say, using the fluid balance chart, I will monitor the patient's intake and output to avoid fluids overload and underload. Then from there, you are going to also talk about drainage. So under drainage, you are going to say, I will observe the patient for the drainage, for the amount, color, and consistency of drainage to detect any abnormalities. So if there will be need, you are also going to say, I will empty the reservoir at least 2 times a day, even if it's not full, for the sake of measuring and infection prevention. Okay, then you are also going to say, I will change the dressing around the wound at least once a day or more often if it becomes soaked or dirty. Now, here on drainage, you are also going to say, I will milk the tubes every 4 hours to simply prevent the drains from getting clogged. As well as I will call the physician or the doctor in case the tubes for or the stitches that hold it in place get loose. So very, very important on drainage. Then you are going to also move to position. Okay, so it's very important that you take note of the patient's position. So here the patient will be nursed in prone position with the head tilted to one side, tonsillectomy position, and this will be aimed at ensuring that the patient airway is patterned as it allows drainage from the mouth and the pharynx. So in case you have problem in mentioning a prone position, you can simply say the patient will be nursed in left or right lateral position, just to simply aid drainage of circulation. Then from there, you are going to move to pain management. So here we are going to say I will administer prescribed analgesics, for example, pethidine, 50 to 100 milligrams to simply relieve pain. Then if need be, we are going to say I will provide also diversional therapy like watching television, which will be offered in order to divert the patient's attention from pain. And you are also going to say, I will ensure that the patient is comfortable in bed as it may aid in reduction of pain. So, from there, we are going to move to observations. So here you are going to check and record vital signs at least 15 minutes or quarter hourly for the first 2 hours, then half hourly until the condition stabilizes. Any deviation or any abnormality should be taken note and reported to the physician. So you are also going to say, I will observe for and report any bleeding from the surgical wound or incision site. I will also continue checking for active bleeding from the wound site. Then there are a lot of things you can observe for here. There are a lot of things you can observe here. Remember, surgery it's about the number of points you write. For example, observe for aspiration of blood from into the respiratory tract, which may be evidenced by noisy breathing and continuous coughing. So it's very important also to observe if the patient or to notify the physicians if at all there is noisy or there is continuous coughing. So there are a lot of points you can consider under observation. Then from observation, you are also going to move to subsequent care. Now, under subsequent care, you start with psychological care. So under psychological care, we are going to say, I will continue to support the patient emotionally to allay anxiety. Then I will reassure the patient that the best is being done to ensure quick recovery to simply allay anxiety. Then I will also give answers to the patient's questions and relatives where I will, and where I can't, I will refer to the appropriate person so as to gain cooperation and to allay the patient's anxiety. And you're also going to say, I will assess for the psychological status of the patient to assist you in planning the interventions. Then from psychological care, we are going to move to nutrition and food, which is very important. So under nutrition, we are going to say the patient will remain new orally until bowel sounds usually returns. So again here, we are going to say on nutrition, the child can even take it, and we are also going to say the child is on light balanced diet, rich in proteins and vitamin C for quick healing of the operation. Then you are going to say, I will also give the child the right diet as in all the 72 hours post-operatively and thereafter. Then you are going to move to elimination. Under elimination here, we are going to observe for vomiters as for the evidence of bleeding. Okay. Then you are also going to ensure that urination and bowel elimination by asking the child and the parents during observation and check and record. So no strain on defecation. This should be emphasized. Then from there, it's very important that you also discuss things containing rest and sleeping. So the child should be encouraged to rest in bed on the 0-day post-operatively. So rest and sleep are encouraged by providing comfort and relieving of pain. So to also need to control noise in the ward to allow the child to sleep or provide warmth. Then also on ambulation and exercises where you go to. So the child is bedridden on the 0-day post-operatively. Then the child can also be ambulated on the first day post-operatively, but within the ward to prevent post-tonsillectomy infection. Then from there, you are going to discuss the health education you are going to give to Philip and the mother. So on health education, we are going to say here you need to educate the family or relative on the importance of fluid taking for 2 weeks. Then to also avoid contact with people who have upper respiratory tract infection to prevent recurrence of throat infections. Here you are going to also say, I will educate the family or relatives or even Philip on special breathing exercise, and I will also explain on the malaria stool, which is due to digested solid blood. Okay, then from there you can also consider points on hygiene. So here you are going to do oral care, blood in them. Mouth can cause atelectasis and infection. So here you are going to say, I will bath the patient day after operation to soothe the body and also provide cream bed to prevent cross infection. Then from there, we are going to look at 5 complications and how they can be prevented. So number 1 is MH, which is either reaction or secondary reaction, and this can be prevented by psychological stability and proper irrigation, or by promoting healing and preventing of infection. Then otitis media can be the other complication, and this can be due to spread of infection from tonsillar bed and can be prevented by prophylactic antibiotics. Then bronchopneumonia. This can be prevented by chest exercise and antibiotics post-operatively. Then atelectasis, which is a collapsing of the alveoli or the lungs. This can be prevented by good ventilation and chest exercise. Okay. Then from there, you can also talk about persistent pharyngitis. So here you educate on avoiding cold, dusty, and even overcrowded. And this is how persistent pharyngitis can be prevented. Okay, so for now, this is where we end. In case you've not subscribed to my channel, subscribe for more videos and more insights on surgery and surgical nursing. So thank you very much. This has been Debo.